Good afternoon, everyone. Welcome to the Migration Policy Center at the Robert Schuman Center for Advanced Studies here at the European University Institute. We are joined in Florence, Italy today and by colleagues across the globe online. My name is Stephanie Acker. I'm a research associate here at the Migration Policy Center. And today's seminar is going to provide some really unique insights on the dynamics of labor migration. We have two fabulous presenters. We'll start today with Dr. Chris Wright, who will be sharing about employer-sponsored visas and alternative options for regularizing migrant worker selection. He'll be followed by Dr. Friedrich Poeschel, who will share his research on how the diaspora could be insurance against public health crises. Each presenter is going to present for 20 minutes, and then we'll have a short time of Q&A after that. This event is being recorded, and I'm sure you'll have lots of things to share. If you do want to share on any social media channel near you, please tag us or the Robert Schuman Center accordingly. So let's dive into things. Let me start by introducing Dr. Chris Wright. Dr. Wright is a professor in the discipline of work, organizational studies at the University of Sydney and distinguished visiting fellow at King's College London. His research expertise is related to labor migration and comparative employment relations with a focus on the drivers of policy change, employers' motivations for recruiting migrant workers, and migrant workers' own rights and representation. He has written over 90 journal articles and book chapters. I think you should have a party when you get to 100, and edited 10 journal special issues and book volumes, including the recently released Protecting the Future of Work, New Institutional Arrangements for Safeguarding Labor Standards. Today, Dr. Wright will discuss employment-sponsored visas and looking at alternative options for migrant worker selection. I'll hand it over to you, Dr. Wright.
Okay, thank you, Stephanie. Okay, thank you. Hopefully you can all hear me. So look, thanks so much for the invitation to present here today. My first time at the EUI, so very much appreciate Andrew inviting me to contribute to this model and to share a stage with Friedrich and Stephanie. So this presentation, it's a bit of an unconventional one in the sense of drawing upon some research we've done with colleagues in Australia, mainly at the University of Sydney, particularly my colleague Stephen Clibborn. We've done work on migrant worker rights and how to best protect them for some time now, and one of the areas we've focused on is employer-sponsored visas. Last year in Australia there was a change of government, and one of the pledges of that government was to develop a better system for protecting migrant workers and for aligning migration policies with other labour market policies. And so currently there's the Department of Home Affairs in Australia has initiated a migration system review, basically a comprehensive review of the whole visa system. And we were asked to prepare some ideas or contribute some ideas about what some alternatives to employer-sponsored visas might look like. So that's basically what I'm presenting today, is some of the ideas that we've put forward. Employer-sponsored visas. These are mechanisms for selecting migrant workers, whereby an applicant can get a visa if they have a sponsorship from an employer in an identified area of skills shortage or skills need. So these have become common mechanisms for migrant worker selection in various countries within Europe, North America, Asia, and Australia. And that's what I'm going to be focusing on mainly today, the Australian system. In Australia, employer-sponsored visas have been the main temporary visa selection mechanism for migrant workers in higher skilled jobs since the mid-1990s. This type of visa has also been used for lower skilled workers in industries like horticulture. For much of the time since their inception, they've been the subject of controversy, and there's two main aspects of this controversy. The first is a criticism that these types of visas compromise workers' rights, and they do that by limiting the ability of migrant workers to switch jobs, to exercise mobility within the labour market. So the constraints upon their ability to switch jobs and switch employers is a constraint that few other, if any, groups of workers are subject to. And that raises issues around people's ability to leave their employer if they're being mistreated, to seek representation, for example, via a trade union or a community organisation or even a legal organisation, and to report employers to authorities if the employer isn't complying with their legal obligations. The second main area of criticism for these visas is that while they're often seen as being a very efficient mechanism of labour market regulation because they match people with skills to employers who need those skills, they're and can be a way of addressing skill shortages effectively in the short term. They can potentially discourage employers from investing in other mechanisms that are necessary for sustaining the supply of skills in the longer term and for providing decent quality jobs. So this raises questions about how efficient they really are, particularly over longer term horizons. So this is what I'm going to be talking about in the next 15 minutes or so, looking at some of the theories that we've engaged with to analyse the operation of these visas, then looking at some of the problems in a bit more detail, then looking at some alternatives to employer sponsorship, which is what we were asked to do for this migration review, and then looking at some, saying a few things by way of conclusion. Okay, so I guess, as Stephanie said, the two kind of main areas of research I do is around migrant labour issues and also employment relations, or industrial relations as it's often called. There are two American academics, Stephen Beaufort and John Budd, who have developed a framework for how to develop, I guess, sustainable or resilient labour market policies. They say that labour market policies, to be effective, need to meet three imperatives. They need to be efficient from the point of view of employers. They need to be efficient in terms of enabling employers to access and utilise labour in a cost-effective manner and in a way that allows for productivity and competitiveness. Policies also need to enable equity, fairness in how workers are treated in terms of the rules that apply to the employment and the regulation of labour. And also they need to enable voice. They need to enable employers and workers as the primary stakeholders within the labour market to be represented and to have some say in the decisions that affect them. So they say that, Beaufort and Budd say that these objectives must be fulfilled so that the needs of workers and employers as the main stakeholders in the labour market are satisfied. And these arguments are not developed in isolation. They reflect kind of the pluralist assumptions that tend to be dominating this area of scholarship, and these assumptions, these arguments contain various assumptions. Firstly, they assume that employment relationships are often characterised by a power imbalance that generally favours employers, not always, but generally favours them, that workers and employers have distinct interests that need to be recognised, and that labour markets are not perfectly competitive, and that unlike other factors of production, workers, to be productive, need to be treated fairly and treated with dignity. So the issue about power imbalance is especially important to keep in mind when considering migrant workers, who are often prone to power disadvantages within their employment relationships, due to various factors, including barriers to information about their rights and barriers to mechanisms to enforce those rights. Okay, so in the work that I've done with my colleagues at Sydney University, we've identified, from the wider scholarship around migrant labour, 4 factors that are important determinants of migrant workers' rights and power and agency within employment relationships, and which we argue should inform the design of visa regulations. The first is having secure pathways to social and economic inclusion, which includes, but is not solely isolated or relegated to residency. The second is mobility, the ability to move between employers to avoid situations of disadvantage and mistreatment, and to ensure that labour migration schemes contribute to labour market dynamism. They need to, the skill shortages that migration policies are often designed to address, or labour migration policies, are verified independently, that skill shortages isn't something the employer claims that skill shortages aren't taken at face value, that they are independently verified. It's something that Martin has argued in his work with Bridget Anderson, and that there are mechanisms for workers to have their rights protected, not simply to have rights on paper, but to have mechanisms to enforce these from government and through independent bodies such as trade unions. Okay, so just looking at the operation of employer-sponsored visas in Australia. So the main intention of the introduction and expansion of employer-sponsored visas since the mid-1990s has been to improve the efficiency of skills and labour supply. That's been quite the explicit rationale by governments for the expansion of this mechanism of migrant worker selection. So governments have been concerned with that objective. They've also been concerned with, motivated to expand these schemes for fiscal reasons, because workers, not always, but tend to be above higher income earners under these schemes. So they're contributing often quite a fair bit to the taxation base. And also they have their access to public benefits and to subsidised public services are limited by virtue of their temporary residency status. So they're very economically beneficial from a macroeconomic perspective, these visas. Employers are attracted to them because they're an efficient way of addressing their skills and workforce needs. But the way these schemes are designed, although it kind of ticks the efficiency box, raises questions around the equity and the voice objectives of labour market policy. So, and that's because temporary migrant workers under employer sponsorship have barriers to mobility, barriers to inclusion, barriers to collective representation. And this increases their vulnerability to mistreatment and potentially can discourage employers who rely upon these workers from investing in job quality as a mechanism of perpetuating the labour market. Okay, so, and these findings are particularly apparent with respect to the main temporary skilled visa that operates in Australia, or the temporary skills shortage visa, or TSS, formerly known as the 482 visa. It replaced a scheme that was virtually identical in its design, which existed until 2018, called the 457 visa. So the design of the 482 visa, the TSS visa, is to address individual employers' recruitment difficulties. Its objective, as set out in legislation, is to address skill shortages, but it doesn't actually do that. So, and that's because skill shortages is a phenomena that's market-wide, where there's a market-wide shortage of workers at prevailing wage rates that can't be addressed by raising wages or improving job quality. So while that's the objective of the scheme, it doesn't actually do that. What it does do is it enables individual employers who are struggling to attract workers because of circumstances that may be within their control. For example, if wages are not competitive, that they are able to use the visa for those reasons. So the design of the visa doesn't take sufficient regard of job quality, which can affect the responsiveness of labour market supply, like prospective workers, to demand. In other words, employers who need those workers. So the temporary skill shortage visa, it's underpinned by single employer sponsorship. So the scheme allows an employer to sponsor a migrant worker in a job regarded as skilled, so managerial, professional, or trades occupations, but the worker is only allowed to work for that employer. If the employment relationship is terminated, the worker has 60 days to find another sponsor before losing their residency rights. And this gives employers a significant degree of control over migrant workers, and a greater degree of control over these workers than they have over any other group of workers that they can potentially employ. And some of the studies we've done has shown that employers who rely heavily on workers under this scheme often develop embedded preferences for temporary skill shortage visa workers because of perceptions that they're harder working, or that they have stronger work ethos, or that they're more loyal. And when we've dug into this, we've found the reasons for this is a consequence of the single employer sponsorship nature of the scheme, the fact that these workers effectively can't move to other employers. They're tied to the sponsor. Okay, so when we've presented this research to government, they've said, well, we're persuaded by this, but give us a better alternative. Come up with some other ways that you could address workforce needs through migration. So these are kind of three ideas that we've put forward. The first is the idea of industry sponsorship, whereby workers qualified to work in an area of identified shortage will be sponsored to work not by an individual employer, but by the industry or the professional field. The sponsorship could be done, and there's some precedents for this in Australia and elsewhere, whereby the sponsorship is done basically by an employer association representing employers in that industry or in that professional field, and also by a trade union. So employers would have responsibility for allocating workers to the individual employers who are experiencing challenges addressing their workforce needs from the local labour market. So that would be a way of ensuring that shortages are being addressed. Trade unions, under this model, would have responsibility for ensuring that individual employers are complying with their legal obligations and that workers have access to representation. Workers would have freedom to move between employers so long as the work that they're performing relates to the area of sponsorship, so in other words, to the professional area or the industry. But workers would nevertheless have mobility to move between employers in that industry or profession as a way of both ensuring that the risks of mistreatment are reduced, but also to ensure that skill shortages are addressed more effectively, because workers could go to wherever their skills are best utilised. Another possible model is mobility visas. And I gave a presentation earlier this year around this general topic, not specifically what I'm talking about, but around some of the things that the government in Australia is proposing around moving away from employer sponsorship. And Kate Hooper from the Migration Policy Institute suggested we look at the Finnish system, which enables workers to have mobility within their professional field. It basically allows workers to have quite a large window to switch employers. So beyond 60 days, as it exists in Australia, it gives them 12 months to find another sponsor within that field if they are being mistreated or if their employer is not fulfilling their obligations to the worker. Another mechanism comes from the design of permanent skill visas in Australia. So in Australia, we've had a lot of controversy over employer sponsorship, but for a much longer period of time, there have been permanent visas for skilled applicants, for family applicants. But particularly the skilled visas operate in a way that's highly beneficial for the economy and the labour market. And the problems of worker mistreatment are basically, there are virtually no cases of workers on permanent skilled visas being mistreated. And so it seems, a good idea from our point of view to look at, to use this model as the basis for redesigning temporary skilled visas. So under this type of system, you can have a points-based type arrangement where workers are given points based on their qualifications, based on their experience, perhaps based on having a job offer, other relevant criteria. And then workers would nevertheless have the freedom to move between employers to wherever their skills are best utilised. And what we ended up putting forward in our proposals to government was this idea of a temporary skilled mobility visa. And we argued that the design of this could take various forms, but no matter what form it did take, it should meet the following principles, going back to some of the themes that I started off with. So that firstly, the principle of mobility, that visa holders should have the freedom to move between employers. If, under one of the proposals we put forward, that workers might get points for having a job offer, what might motivate an employer for offering to nominate an applicant in this situation? What's in it for the employer? Well, what we said is that, well, the employer would have the first opportunity to employ the visa holder. But the visa holder's ability to move to alternative employment would give that employer with an incentive to ensure that workers, that they're complying with their legal obligations and that they're providing competitive wages and conditions to entice that worker to stay with them. That another precondition we said was that worker protections had to be institutionalized. So again, it wasn't enough simply to say, here are your rights. There had to be mechanisms to enforce these. One thing that could be done in this regard was to have a mandatory induction process overseen by the relevant government agency dealing with labour inspection and also involving the relevant trade unions. Another precondition was residency status, having a defined and clear pathway towards permanent residency, and also removing or at least loosening the current restrictions that exists upon the ability of skilled visa holders to access social security, subsidised public services, post-arrival support, and other mechanisms of economic and social inclusion. And finally, around skills, ensuring that skill shortages were verified independently and that job quality was assessed before a particular occupation could be eligible for sponsorship. Okay, I just want to finish off by kind of speaking a bit more generally about how to redesign skilled migration and labour migration programs in a way that's kind of more fit for purpose. Two political economists, Lucia Beccaro and Chris Howell, have put forward an argument that's been quite persuasive in kind of the labour market studies field, saying that the 21st century has been defined by what they call a common neoliberal trajectory. But basically what they mean by that is that across all countries, we've seen an expansion of employer power within the employment relationship, and that workers' power has diminished. But I think, and that's been a very influential and persuasive argument, but I think we're starting to see the turning of a tide in the broader labour market policy realm. We're seeing bodies that traditionally have been pretty ambivalent about these issues in recent years advocating and implementing initiatives that have much more explicitly tried to strike a better balance between efficiency, equity and voice. And we see this in the European Union's new minimum wages directive, which only came into operation or it was only passed in November last year, and in the OECD's strong about turn on issues regarding worker representation and wage determination, advocating strongly for collective bargaining. And I think that these developments are relevant because they highlight the need for scrutiny in the way that migrant worker policies are designed. To echo what Martin argued 10 years ago, policy principles need to reflect more than simply employee interests. And that's especially the case when it comes to employer-sponsored visa schemes, which embody a profound inequality in terms of the limits on people's rights and mobility within the labour market. And so what we've put forward is we've tried to, I guess, essentially what's informed our arguments and our prescriptions is a need to strike a better balance between these three objectives of labour market policy and how migrant worker regulations are designed. So I'll leave it there. Thanks, Stephanie.
Thank you, Dr. Wright. So we're going to go now to about 10 to 15 minutes of dialogue where we can ask questions about the presentation. If you are joining online, you can put your question in the form of a comment and we will read those, but I'll start with any questions from the room. Again, when you ask your question, if you could just hit the green button on your microphone. Martin.
Yeah, thank you. I won't be surprised to hear that. I think this is really interesting. I'm interested in these issues. I have many questions, but I'll just kind of raise three issues and you might not have answered to address all of them. One issue you didn't mention, I wonder whether it's not such a big political issue in Australia, is this challenge with these programs to kind of make labour migration schemes complementary to whatever is perceived to be domestic workers' capabilities. So how can migration kind of meet the needs of the domestic labour market? And what you talked about suggests you're thinking about short occupation lists, but of course there's also labour market tests, which you know very well. I'm wondering whether you can comment on that, the extent to which there's controversy about the admission of migrant workers in terms of whether or not they're really needed over and above this kind of discussion about short occupation lists. And the second point, some of the issues you raise, I think I would agree with many of these issues, and they've also been some of them have been discussed for a while, but I guess my question is, what's going to kind of change the needle here? What's going to what's the politics of some of this? I mean, as you know, employers will say they're reluctant to recruit migrant workers if the migrant worker can walk away on day 2. So there might be an employer in an economically depressed region of the country that pays lower wages, and they bring in migrants, and then the migrants come and they immediately go to another employer in a region that pays higher wages. So that employer will never end up with migrant workers. So maybe it's a question of conditions, but how do you deal with that kind of argument? And thirdly, and finally, can you say a little bit more about how you think about equity here and voice? Because these terms, I suppose, need some unpacking. I mean, how would you think about a situation where actually migrants make a choice or voluntarily take up these jobs under conditions which might not be completely in line with what you propose, but they're still moving voluntarily, even those terms are contested as well. But you know the debate I'm referring to. How do you refer to that? Thank you.
Thanks. Any other questions in the room? Yeah. Okay. From Sophia Kagan, she wants to know that these are some really interesting ideas, but are there global examples of industry visas co-managed by employer associations and trade unions?
Okay. Thank you. Okay, I might start with Sophia's question first. I mean, the one kind of example that comes to mind, or two examples, both from Australia. So kind of examples a lot close to home from my perspective. There was a scheme that was designed in 2012 called the Enterprise Migration Agreement Scheme. And this was basically designed on the basis of employer association sponsorship, not with unions, just employer associations for the mining industry. Basically, the scheme was developed, but it never properly got off the ground because of political controversy, because the mining industry in Australia is very kind of it's a target for a lot of consternation and criticism, and also the economic circumstances also. Basically, we had a big mining boom. This scheme was developed to help perpetuate that mining boom. The mining boom turned into a bust. There was no longer a need for migrant workers anymore. So, but the design of the scheme kind of was looked pretty good and was based on this notion that the association sponsors and allocates to members. Unions weren't involved, but I think they should be for the reason that they can play a key role in the enforcement question. But I'm not aware of any others in other countries, so I'd be keen to hear if anyone knows of any. So yeah, Martin, so you and Bridget especially have done more work on this than anyone else in the world, I think. So we've been very influenced by your work on this. So yeah, okay, labour market tests, shortage lists, both have problematic. Labour market testing is seen as very tokenistic, and I think there's a good argument for that, where employers are forced to test the labour market to recruit locally. Often turns into a very tokenistic exercise. Shortage lists. I mean, these can work okay in industries where the jobs don't change much, like in hospitality, for example. The occupations on these lists are basically the same over time. Restaurant managers, chefs, cooks. But if you look at an industry like IT, the occupations in shortage change from year to year, sometimes even month to month, because the nature of work in that industry changes very quickly. So one thing that's been put forward, it's got a lot of influence in Australia, is the idea of income thresholds. I'm not such a fan of this because I think in industries where which are lower paying, and not just which could include health, like nurses, for example, as well as chefs and cooks. A national income threshold is a very blunt instrument. So, but I mean, what's happening in Australia is that the politics of this have moved very quickly, and for many years there's been a lot of discussion around this. And finally, there's a government who seems to be actually quite motivated to initiate some reforms in this area. And so what they've done is they created a body called Jobs and Skills Australia, which is a bit like a Migration Advisory Committee Plus. It's going to bring in a more nuanced assessment of employer demand, labour market needs, and how migration fits into this, but looking at this alongside training, education, and other labour market policies as well. So, I mean, we'll see what happens, but I'm quite hopeful that we are starting to see the creation of institutions to enable migration policies to be better integrated with other labour market policies. The politics of this, employers kind of are resistant to anything tantamount to protective legislation for workers in Australia. But I think in this area, they recognise that there are some big problems with current mechanisms that are, they're not working very well. So I think employers seem to be more open to systems that would work more effectively for addressing longer-term labour market needs. But this issue of regional differences that you mentioned is really key, because Australia is a very geographically diverse labour market. And that's something that governments and employers as well, employer associations, it's hard to design national policies that meet the needs of different regions. Equity and voice, I mean, maybe we can have this is a long, I could talk, maybe we should have a discussion about this afterwards, because I find your work on this very persuasive around, how do we understand equity? Different workers have different attitudes towards equity or different needs. So, but that's something for a further conversation, perhaps.
Andrew, go ahead.
Thanks, Chris. I just wanted to pick up on something you mentioned when you responded to Martin. Excuse me, and also what you were talking about during the presentation, just about the use of evidence. Because I'm kind of interested in this issue quite generally. And you said, well, you just mentioned in your presentation when we're presenting to government. But I was wondering about the way in which there is the kind of systematic use of evidence around migration in the Australian government, where there are examples of a kind of uptake of evidence influencing policy, to really to understand the role that expertise can play, but also to understand a little bit more about the kind of contingency of this, because you also see that a lot of this seems to hang on this new government and institutional initiatives that have occurred around the new government. So I'm wondering to what extent that is important in this, so this is quite contingent, or whether there are kind of maybe more structural factors which generate more use of expertise. And as a final thing, whether what we see in Europe, which is a kind of more maybe populist counter-reaction to some aspects of migration policy, has also been evident in Australia too, to kind of attack or delegitimize the role of expertise in policy, and whether there are countervailing voices which are also quite present, maybe not in the arenas where you're present, but also influencing policy. Hopefully that makes some sense.
Yeah,
thanks.
Migration program. Sorry, thanks, Friedrich. Which is, I guess, has a much longer historical legacy in Australia than temporary migration. There's a good evidence base, like the government maintains and oversees surveys of visa holders, has very pretty sophisticated data around the permanent settlers and citizens who come through migration channels. But around temporary visas, it's very, very patchy. There's some big evidence gaps in terms of what information government has, and researchers have filled that, or have tried to fill that void. So like every year, the government in Australia will have a consultation with industry and with often researchers, and I've been involved in these. I'm usually invited along to these, have been in the past, and they'll say, okay, we want your views on what needs to happen around the permanent migration program. And we'll say, well, permanent migration program is working fine. The temporary migration system is where there are some problems. Oh, we don't want to talk about that because we don't have enough evidence at our immediate disposal to talk about that. So, that I guess this has informed a lot of my work over the past few years, is working with other colleagues to do research on how temporary visa systems are working. I mean, so around other aspects of temporary migration, we've managed to achieve some change. So we've done, I mean, aside from temporary skilled migration, international students play a very important role in the labour market, in hospitality and retail. Working holiday makers or backpackers, working holiday visa is a scheme that's operated in Australia for many, many decades, but in recent years has basically transformed into a de facto work visa for the farm, the horticulture sector. We did with several colleagues, did a very big, large-scale series of studies looking at the role of migrant workers in the industry. We were engaged with employers, employer associations, engaged with unions, and basically developed recommendations that have been influential in the policy debate. But in terms of your question about contingency and populism, previous Conservative government basically ignored our evidence and gave into what the loudest part of the most populist part of the farm employer lobby, what they wanted, which was access to exploitable labour, essentially. So, I mean, now that's starting to change under a new government, but it is very much contingent upon having a receptive audience of people in power. So highly contingent, evidence is patchy. Research plays a role in addressing that, but governments don't always pay attention to what the research evidence says. So I hope that kind of answers your question.
Thank you, Dr. Wright. We're going to now turn it over to Dr. Friedrich Poeschel, who is a senior researcher at the European Academy in Bolzano, where he conducts policy-oriented research on migrant workers in essential services. In 2019 and 2020, he was here at yours truly, the Migration Policy Center, where he helped establish the Migrants Hub, focusing on migrant workers and the resilience of essential services. He is trained as an economist from the London School of Economics and the University of Oxford, and has worked extensively in international organizations, including OECD and the EU Agency for Asylum. Today, Dr. Poeschel is going to explore the potential of health professionals in a country's diaspora as a reserve for times of crisis, and offer some concrete suggestions on bilateral agreements that could effectively ensure countries against a shortage of health professionals. So I will turn it over to you.
Thank you very much. All right, thanks for the invitation. This idea actually goes back a while, goes back to April, May 2020, when I was actually here, or like in lockdown here. And only 2 years later, we have a first draft. So that's a good development. Now it's the second draft that I can present. So in a nutshell, what I'm trying to argue here could be called global redeployment. So redeployment is something known in medicine. It means sending medical staff to where they are currently most needed. Basically, you send your resources to where the fire is, across geography. And during the pandemic, we saw this happening. We saw this happening within cities, from one hospital to another. We saw it happen within regions and sometimes across regions. But across borders, very rarely. So there are some stories that became known in Italy. It's about 50 Cubans arriving, for example, but also the fact that they are so known means this was a rare event. And I will argue that this is mainly due to licensing requirements, that it happens so rarely across borders. But none of these barriers should apply to returning immigrants. So that is an exception and a possible avenue. And I want to explore the feasibility of this and also the potential as a response to public health crisis. So this paper is very much like drawing together some dots from migration, from medicine, from the pandemic, and whereas each sort of constituent part might not be terribly new by itself. So what are the key considerations for this being a feasible way to respond to a public health crisis? So while we start with the need for it, we need a surge capacity for the health system because medical staff can come under extreme pressure when the patient numbers rise. We remember the discussion even about triage, which must be a terrible thing, but that's how far we got. So during COVID-19, the people working at the front line, and especially the medical services, would also become infected themselves and would have to quarantine or would fall ill. So you also have a reduction of medical staff levels there. And then there's papers, which I mentioned here, only 2 of them, that lower medical staff levels per patient are associated with higher mortality. This is not very surprising, but it has been shown sort of across, so using various circumstances across particular examples. In general, the better the health system can cope with a public health crisis, the less we need extreme measures that affect the whole society or the economy, like lockdowns. So also there's an interest to have some sort of surge capacity that allows the health system to sort of rise up to the task. And in the years ahead of us, there could be more mutations of COVID-19 virus. There could be extreme events related to climate change. There could be spreading wars. And all this implies that sort of making the health system more resilient is high on the agenda. And among the sort of 3 stock photos, I only found here some medics who look mildly annoyed, but this of course doesn't really capture it. We know how difficult this can become. So how would we think of responding to a public health crisis or creating this surge capacity through international mobility, basically drawing on migration? So while during the pandemic, it became clear that this licensing requirement to practice actually in the medical professions, doctors and nurses, is as important as ever, even in this emergency setting. So there were some adjustments made, and I could go into details here. So for example, students close to graduation, they would get like a temporary license and so on. So there were some adjustments made, but also by and large, these examples say, well, it wasn't that suddenly it became a very easy to enter system, right? So the licensing requirement remains very strong, and the adjustments that were made concern people who were sort of training for this system or had been working in this system, in the national system already, whereas people from other systems with qualifications from abroad, they faced strong barriers still during the pandemic, and in general, there are so many stories of people being surprised how difficult it is, given a long sort of career they've already had in medicine, to then practice in another country. There's more practical problems, actually, if you want to do that. There can be a language barrier, right? There can be lack of familiarity with the health system and the procedures, because they vary between countries. There can be problems with visas, even if sort of a country wants you there and as soon as possible, getting the visa from the embassy and so on, all this can take time. There might be border closures as we had them during the pandemic. So these are things that are also making this more difficult. And the observations from the pandemic and also from some development contexts tell us that, yeah, this is very much an issue in practice. So for example, something that came out of the work actually of the Migrants Hub that was already mentioned is that Peru has lots of Venezuelan refugees in the countries. And they realized we can draw on the medically trained people among the refugees to fight the pandemic. They wanted 4,000 doctors, I believe, and they got 200. And this has a lot to do with licensing. So I invite you to read that contribution there. Then there's something from development assistance that finds, okay, if you have Doctors Without Borders or NGOs coming in, quite often they do very much their own thing. Right, they can't really fit into the system because that would take too much time, or they don't know it and so on, and you just have sort of frictions. What happens is they do like a niche project, and that's it. And it would be much better, people than on the ground say, if they could sort of be integrated in the structures. So what is the exception? The home-trained diaspora is an exception. I mean, people who obtained at least one medical degree in the country that we're interested in, and then emigrated from this country. Consider that your sort of medical diaspora, doctors and nurses alike. They have a local qualification. Their qualification, at least one of them, is not foreign, so they should have a much easier time to get a license if the country only wants, because they can give it also to students close to graduation. They necessarily lived in the country to get this qualification for some time, so there shouldn't be no language barrier. If they got some work experience in the health system before emigrating, they should know the system to some extent, even if it was some time ago. That is a basis to start on. And an important point is also that there are some surveys for different contexts of immigrants with medical qualifications. So, for example, you ask them in Belgium and they come from, I don't know, Sudan. Would they be interested in going back, right? And well, by and large, if you put yourself in their shoes, you know, imagine you come from Sudan and you've worked very hard to have your career in Belgium and you have your job there and everything. Are you going to risk it by going back to Sudan in a crisis? Probably not. This is why I believe these surveys come up with the finding that, yeah, in general, they are interested, but only for temporary returns, or mainly for temporary returns, right? So what does this mean? It means that they don't want to give up what they have built up in the destination country, their job, and also their resident status. If you're away for long enough, or if it's somehow, you know, not on the books or so, and people find out, authorities find out, you can even lose your resident status, everything you had on the clock towards permanent residence. So there's a lot of uncertainty about how it's possible to return for medical professionals without sort of getting their status, their position in the destination country without putting that at risk, basically, and getting into trouble. What would be a way to fix this? Well, there could be legal frameworks that would facilitate these temporary returns. They could be bilateral, they could be multilateral. In general, you want to make sure that immigrants can keep their job in the resident status. And these agreements would also help to actually quickly mobilize them. So where these returns happen now, what you see is that there's some association or some very active individual that arranges for this and that says, you know, here I've got contacts, you know, to the local, to the health system there in the country, you know, would you be on board? And then the negotiations can start with the employer. For how long can I be gone without getting into trouble and so on. That all takes time and involves a lot of uncertainty. If there were already sort of clear rules, procedures, you know, what you can do, what you can't do, where are the contacts, this would help a lot in bringing people back quickly if they're willing to help out in the home country. Of course, the destination countries must be on board. And this is a bit of a tricky one. What do they gain from seeing, health professionals that they've recruited from abroad going back temporarily? Well, so ideally it's mutually beneficial, and you get these examples. For example, the UK has a lot of health professionals from New Zealand, and New Zealand has a lot from the UK. So there's a interdependence. You could that's an easy case. But of course, there are many other cases where it's really rather one-sided. One reason to still sort of find an accord with the origin country would be to make sure people are coming or keep coming from there, because the origin country can also pass some exit restrictions. And there was a discussion about this during the pandemic, so that say new nurses from the Philippines that the US really waits for cannot leave because the Philippines say, we need everyone ourselves, something like this. So there's you know, something to negotiate about. You have the problem within the EU also. If you think about Romania, Bulgaria, there's lots of health professionals coming from there and working outside Romania and Bulgaria, but still within the EU. So there might be a role for the EU to coordinate some sort of return mechanism that would help out Romania and Bulgaria and many others, given the particular crisis. What I want to highlight here is that actually temporary returns are already explicitly foreseen in this WHO code of practice on the international recruitment of health professionals. So this is sort of a landmark document in this context. And it does address this question. And basically, if you were in a situation where there's a crisis in the origin country and you don't allow people from there to temporarily go home and help out, that would clearly violate, I would say, the letter and the spirit of this WHO code. That's what I find after sort of reading through it carefully. It comes up several times. What it might mean is that even existing bilateral agreements that say we want to adhere to this code, or like we acknowledge the code and it should sort of guide us in our policy making, they would already then by implication accommodate for such returns, right? So the code says this is something that you should allow for. Let's briefly quantify, now that we looked at feasibility, would it be feasible to have temporary returns during a public health crisis? Let us quantify a bit how large the potential of a medical diaspora is for the countries around the world. So my data on doctors and nurses come from the OECD. They cover 23 countries for nurses and 25 for doctors. And this is by where they were trained, right? So I can isolate, and I will look only here at people who were trained abroad and are now working in an OECD country where they were not trained. I also use WHO data on the current doctors and nurses in a country, and here I'm looking mostly then at the origin countries. So I know for every country in the world, basically, how many doctors and nurses they have around the year 2020, and how many doctors and nurses that they trained are now working in one of these 25 OECD countries, right? So I cannot look at other diasporas, say in the Gulf states or in the, who knows where, but in OECD countries. But still, that must be a pretty big chunk. And of course, well, I use also World Bank data on population by country, but that's only to get a relative measure. So yeah, this is how I get data on the home health workforce and the medical diaspora, at least in the OECD, for more than 170 countries. That's the non-zero observations in the data set. And around 2020, sometimes you have to make little adjustments. So in terms of methods, the question here is, can diasporas be mobilized to make a significant contribution, to give a significant boost to the health workforce at home? The main indicator is, of course, the diaspora size relative to the health workforce at home. But I also check whether it's sort of significant relative to the population. But I was thinking, I mean, we can debate this. I was thinking mainly about, would it boost the health workforce, the health system at home, if enough of them return. I also use the Herfindahl-Hirschman index. That's a measure for concentration used in economics. And here, basically, it helps us look at the question, okay, do you have all your eggs in one basket? Which means if that basket has a problem for some reason, say if all your emigrants are in one country and that country has some problem at the moment, then none of them will be allowed to come back. And that is a problem for you as the home country. So concentration might be a bad thing here. At the same time, some concentration, that's the next measure, the minimum number of destination countries, might be good, because then you can quickly contact a significant number of your doctors or nurses, right? So if you have to have 15 bilateral agreements to contact enough people so that it makes a difference at home, that is quite tedious. If you have, if you make 3 agreements and you can mobilize people, that would be quite nice. So in that sense, there should be some basket with many eggs at least. This is then what comes out of it. Basically, the green shading is just like the darker, the better. So you have, the bare number, again, mostly for 2020. If I use a different year, then there were some reasons for that. You can relate it to population, which is informative, but again, not my main measure. I mostly related to the number of doctors at home, and then separately for nurses, also related to the number of nurses at home. And then there's the concentration. So for example, you see down there for, say, Benin, like 75.75 is the rather high concentration of the diaspora in a few countries. So that gets only a light green, not so great. And then the minimum number of countries to reach a predefined threshold. So the number there gives you the countries. So how many, say, Afghanistan would need to have bilaterals only with 2 countries to sort of access or contact 3% of the doctors that they currently have in Afghanistan. Whereas Belarus, I think it is down there, would have to do 9 such agreements to reach 3%. So the 3% and the 1% for nurses, because there's generally fewer nurses, that is a bit arbitrarily chosen. I mean, I choose that after looking at the distribution of things. But yeah, that could be always adjusted. Again, the idea is a significant boost to the health system. Yeah, otherwise it's just you run an algorithm over this. At the end, I sort of try to suggest a grouping, and this is basically me looking at these numbers and saying, okay, within 5 groups, I would put them here. And sometimes, of course, this is if you're in the top group, for example, that would mean you're best insured. That is often driven by just there being a lot of emigrants, but not only. So there's also these 2 other measures about the concentration of them, which means like how likely are they to be accessible, and then practically accessing them through bilateral agreements. So there's some qualification, and perhaps most informative are some examples. So if we start with Canada, Canada I put in the upper middle group and not in the top group, although they have a lot of, so relative always to the health system in Canada, there's a lot of Canadian doctors and nurses abroad. Why are they not top group? Because they're basically all in the US. So if the US doesn't let them go, or there's some crisis in the US at the same time as in Canada, then Canada cannot really call so many back. So that is the main reason why I downgraded it here. Suriname has lots of doctors and nurses abroad, actually very many, in different countries. And at the same time, they wouldn't need too many bilateral agreements to access a significant number. So they are top group. Angola is bottom group because there's actually not very many doctors or nurses from Angola now practicing elsewhere. So you can go through it. India is yeah, in the upper middle group, so it's rather well insured because there's really a lot of doctors and nurses. So sometimes you get only doctors and hardly any nurses, or the other way around, and that would be an issue in my grading at least, because you need basically some of both. Japan is the bottom group because, I mean, have you ever met a Japanese doctor or nurse outside Japan? I haven't found anyone who has. Their number is very small and extremely small compared to the Japanese health workforce. Ukraine, interestingly, is was before the war in the middle group, so there might be a potential to draw on currently, and also for reconstruction, let's say. So if we look at this for the same, so this was all for doctors, the same for nurses. So the map is generally a bit brighter, yes, because there's not so many, at least not according to the data. Perhaps nurses are not always reported as well as doctors. That is a possibility. But it could also be that doctors are just more mobile internationally. That would fit with the observation that high-skilled people are or tend to be more mobile internationally than medium or low skilled in terms of sort of immigration rates by country. So here for the US, for example, the US is in the lower middle group. By and large, few doctors and nurses abroad. What is Namibia is an interesting example, lower middle group. There's some nurses from Namibia, and just based on that, you could put them in a higher group, but there's hardly any doctors, basically, really hardly any. So that is a problem there, and that means a bit of a downgrade. China is the bottom group. Yes, there are tens of thousands of doctors and nurses from China practicing abroad, but compared to the Chinese health workforce at home, it is under 0.5% or something. It cannot give a boost to the Chinese health system, according to this measure. Right, Portugal, perhaps the last example, upper middle group, and you might remember when Boris Johnson was in hospital and came back and said he barely made it out alive. He mentioned two people who looked after him. I think one was Portuguese and the other was Polish, right? So yeah, Portugal is a rather well insured country by this measure. So what would be then the most suitable bilateral and multilateral agreements? So for Canada, of course, if you look at doctors or nurses, it's the US, but followed by Australia, then Germany, then Netherlands and Israel. Not Netherlands, sorry, New Zealand and Israel. And kind of similar for India, right? So I'm not going to go through them one by one, but there's some countries coming up a lot. It seems that there's also a lot of exchange going on between English-speaking countries, or if you speak English in your home country, then you have a lot of options. That's the feeling I get. But then it also depends on other kinds of migration or on sort of relations that are already there. If you think of Tunisians here and the large community of Tunisians in France, that the Tunisian doctors are mainly in France, and then followed by Germany and Canada, and so on, some in Switzerland. Where I put dots, that means there's no way. So for Ukraine, for example, according to the data, there's no way to find 1% of their nurses abroad. Now probably there is, because this was before the invasion started there. But at the eve of it, there were just not enough nurses abroad in that case. And in Portugal, it's not enough doctors. So that gives you an idea of what one can do with these data. I mean, Mauro knows the data well, I think, and is probably not surprised. But yeah, I think they are quite useful. So to conclude, if we think about how to respond to public health crisis, much like the pandemic we saw, but there might be many more and many different ones in the future, then emigrated health professionals seem particularly well placed to assist and to basically provide the search capacity to the health workforce at home, because they don't have the problem with licensing, and at least not nearly as much as others would have it. And they have a couple of other practical problems, much less than others. And the evidence suggests that there's a certain willingness for them to return if it is temporary, because otherwise they would risk too much. That's my interpretation, at least. But the surveys say, yes, temporarily is the interest. So we looked at well, some maps, but basically this is 170 countries, and for not for all of them, but for many of them, and for a very diverse set of countries, you find that the diasporas of doctors and nurses that they have do provide a significant search capacity, depending, of course, on how many of them come back. But so say lots of countries have, say, 3% or 5%, and sometimes 10 or 15%. For some island, it's more than 100% of doctors abroad compared to what they have at home, right? But let's take 5%. So like the doctors you have abroad are 5% of what you have at home. Is that significant? I think it's very informative to look at something like they have in France. It's called the Réserve Sanitaire. It's something they have in place exactly for a crisis situation, so that there's some extra people that can be called in from retirement or from students or from other government functions to help out in the health system. And in normal times, this is 0.4% of the health workforce, 0.4%. For the pandemic, they quickly increased it to, I think, 2.4% of the French health workforce. So if you have a health workforce and you have 5% abroad, then that is a significant potential in terms of these French standards, right? And you can say just a fraction of them come back temporarily. It will, by that French measure, already be quite something. And I argue that to access this insurance that diasporas can provide and to quickly mobilize them, it would be good to have bilateral or multilateral agreements that would have to be concluded or perhaps just adapted from existing agreements, because the WHO code already calls for this and foresees this. Thank you.
Thanks. Let's open it up for questions. Any from the room?
Thanks for a really rich, fascinating presentation. I was wondering, in the case of these bilateral or multilateral agreements between countries, how do you envision who would pay basically and how much? So just to bring an example, the NHS goes to recruit nurses directly in Portugal at nursing schools, and they can offer 2, 3 to 5 times what a nurse would make in Portugal. So then I would imagine that in this case, even if people are willing to return temporarily, but if you're paying rent in London, Portugal happens to have already in place a return program called Regressa, by which they sponsor their citizens abroad to come back, and basically they automatically convert your degrees abroad, they pay for your ticket, your move, and top up your employment by some 500 a month. But that does not come close to kind of compete with the salary of somebody who's abroad. And so just to have an idea on that. And then I was wondering if you considered, or if you see any differences in public health systems and private health systems, and how that would play out. Thanks.
Yeah, thanks a lot for the presentation. So yeah, along similar lines. So I think like that you talked about this temporary terms and bilateral agreements. So you mentioned like that there are two factors, like cultural barriers, lack of uniformity in terms of licensing. I think it's the incentives is the missing link that you probably haven't mentioned, and I think the risk is that if you factor in incentives, you see like a sort of a one-way traffic, like from south to north instead of so. And this is also related to the table. You said that all the partner countries, they're basically OECD countries and none from the south. So this is the first, and second is about data. So the first, if I recall correctly, so the main data set you're using for mobility of doctors and nurses is the OECD data set, right? So I used it once, and I remember like the quality was not very good. So you had like a lot of missing observation, a lot of so for instance, for a given country of origin, you didn't have information on some destinations. And if you're using like this concentration index, so I think like, I mean, using only this data set could create distortions in the data and also in the conclusions you're drawing based on the analysis. So I wanted to know a bit more about the data you used. Thanks.
So let's actually go back to you, since those are two in-depth questions, and then we'll go to you, Mark.
Okay, thanks a lot. Well, let me start with something that would answer both questions a bit. So who pays when people go, and it also addresses a bit this the one-way problem in health worker migration. So I would say But well, that would have to be sort of fleshed out in practical terms. But I would say it would make sense for the destination country to pay, given that it would be a temporary thing, given that they probably have and should have a bit of a bad conscience about recruiting all these people from countries that would very well need them themselves in many cases. So the least they can do is allow these emigrants to go back for some time. We're talking about a few months basically, right? Or it can be 6 weeks or so. And help out at home and cover the cost of that. It's something limited to pay and to do, given for the benefit you get from these emigrated health professionals in the destination country. So it is often one way, but well, as I said, like the destination countries are quite aware of it, I think, or should be aware. I think they are aware of it, and they feel uneasy about it. So perhaps they're happy to do something, at least in a sort of symbolic way. After all, you only have to do it, have to pay for them to leave temporarily if there is really a crisis in the home country. How often does this happen, right? I guess it comes down to definitions also. Public versus private. Well, in the public system, I guess the WHO code would be perhaps more important. But otherwise, does it make a difference whether it's for profit or not for profit? That's a good question. I can only speculate. That is a dimension I should sort of comment on. But also in the private system, perhaps I wouldn't necessarily expect that the private system would be less open to this, in the sense that they might be more flexible to allow for temporary returns, and they might be very aware that this is a way also to recruit, or this is something that you can put on your shoulder and say, okay, we recruit you from abroad, but there's this possibility for you to do this sort of unpaid leave and help out at home if there's a crisis, and that could also be a way to keep employees happy. Because when you look at the surveys, it does happen, right, that people sometimes, and I'm talking of health professionals here, go back and help out for some time. So there's some examples from Afghanistan, for example, something from Ethiopia. So that is all in the paper in detail. And why do they do that? It is partly about personal satisfaction, right? It is I guess it is hard then to sort of sit abroad when there's chaos at home and you can't do anything and so on. It's actually they would like to do that, and if you allow them to do that, or some of them would like to do that, would go and help. After all, many medical professionals like the fact that they can help people about their job. So if you let them do that, they will be happier employees, and they will sort of recognize that, and the employer will sort of have a benefit that okay, you're happy because I allowed you to do this, you'll be my happy employee. You get what I mean? It's a give and take, right? So yeah, that's the answer on that. Sorry, a bit long. Briefly on data quality. Sure. As I said, one can get the impression that there's underreporting of nurses. I don't know. The basis on which the OECD data are collected, I think, is quite good in the sense of registries, who's actually practicing, and they have to all be registered to practice and so on. And if you look at the data series year by year, because it gets collected every year, and I use the latest one, which again, if there were any issues, hopefully some of them got fixed in the latest update. The series seem consistent. So these countries or countries are reporting the same things every year with small changes only. Then that tells me that this is as reliable as it gets in terms of these data. Of course, there's always problems of comparability across countries. But again, I found it, I looked at it for a long time and I didn't find major problems, let's say, that would somehow keep me from using them, except sometimes you see also in the WHO data in particular, you see numbers suddenly go up in 2020. And that's why sometimes I haven't used 2020, because I guess they're counting in now some more people that they have somehow mobilized internally or domestically. And then that would be a biased measure. So I'm then using 2019. So, but apart from that, I can't complain.
Thanks, Martin, over to you.
Yeah, I thought it was just really very effective presentation. It reminded me a little bit of the global skills partnership proposal. I think it might be helpful for you to kind of look at, I mean, you know this very well, but just in terms of how it was initially presented and how it then expanded and how it was taken up, because there's this idea of some general principles, look at different people's incentives, and then you might have different types of implementation in different contexts. So I can really see how this kind of idea, I think, could be of great appeal to even the European Commission, who's looking for things to do in this area. Given that most of the action is at member state level, so where can the European Commission add value? Well, they're trying to support global skills partnerships. They might maybe support something like this as well, I think. But I think my question is building on what Mauro said, and you've begun to answer it already, is I think in terms of presentation, I think it would really help if you focused more and even more on the destination country and the kind of what's in it in the destination country. And maybe what's in it is the wrong way, I mean, it's kind of brutal way of putting it, but given that destination countries by and large currently in their immigration policy making do not care very much about other countries, so why would anybody want to do this? And I think there's different ways of thinking about this. So I think you've begun to give an answer, which is that, well, you know, we have a debate about the ethics of recruiting highly skilled workers, the brain drain, and different economists have proposed different things. There's the kind of Bhagwati tax and different ways of doing it in response to this. And you saying that maybe countries have a bad conscience. But well, I mean, if there's some will, and maybe among some people in some destination countries, some departments to take account of these concerns, then maybe this would be one of the responses. And so maybe one could look at it not from a strictly kind of economic impact point of view in the receiving country, more from a development perspective, for example, from a global public health perspective. So when you think about the kind of political feasibility of this, I imagine to argue that this is in a kind of narrow-minded economic interest of the destination country will be hard, especially if those doctors and nurses are leaving a country where there's also a crisis. I mean, if there's only the crisis in the origin country, it's different, right? Then presumably it's easier. But then otherwise countries might be reluctant to let people go. But I think it might have to be couched in slightly different ways. So within, you know, given that there are these issues, that is ethical concerns, that is global questions of justice, what can high-income countries, for example, do? One of the things they can do in addition to financial aid is maybe, you know, support policies such as this one. I mean, this is just one idea, but I would spend more time kind of going through the number of factors which might be helpful in trying to justify and kind of market this policy in the countries that currently employ the doctors and nurses.
Thanks. I also wanted to ask a question. I was curious how you chose kind of this as a focus as opposed to something, because it seems quite, I can understand that the bilateral part means you're only making agreements with maybe a few countries, but why, if you're making an agreement, not try to tackle something like a common licensing in emergencies or something that would kind of expand the pool? So it's not just trying to pull from our diaspora, but could pull from maybe a range of things. I know surge capacity is obviously so crucial, so it's a hard thing to tackle, but I was curious more kind of what other things you thought of to really then focused on kind of on this as being like the most strategic way to build that surge capacity.
Okay, thanks again. Yeah. Well, starting with your last point, why bilateral agreements? Okay, there can be multilateral agreements. I think that's just currently the way migration policy expands and is made. If you look at countries trying to recruit medical professionals from abroad, they basically go for the bilateral setting with just a few selected countries. That seems to be the easiest way in a sense. And yeah, and I would not be very optimistic about having, say, a standard for emergency licenses up by the time of the next crisis. Let's say that would take so much negotiation and so on, and then you would still don't know whether it works in practice, you know, when it's put to the test. So it has to be to some extent specific to say the countries involved, I believe, just sort of from a practical perspective. But interestingly, I mean, during the pandemic, we saw this. We saw temporary licenses being given out, and there might be a lot to learn from these things. Yeah, I'll stop there on that. But that already touches also on the EU role. I agree, Martin, that the EU could be quite interested in doing this sort of at a somewhat centralized level. Then it wouldn't be global, but it would be perhaps an EU standard or an EU sort of regulation, not regulation, but whatever mechanism that applies to all member states. Because in the end, the EU would have to represent both origin countries and destination countries, right? Thinking of Romania, Bulgaria, Portugal, and also Germany. I think Germany is losing medical professionals to Switzerland, big time. So the problem touches basically every member state in one way or another. So I think there's a role for EU or other similar levels, sort of supranational levels, could be the African Union also to come in and try and negotiate something. You mentioned, yeah, why should destination countries be interested in this? The ethics is certainly one, but yeah, it's interesting that you mentioned the development aspect. It can help, say, developed countries to make sure that certain health crises in developing countries stop, right? So they would have an interest in certain pandemics not spreading, or in certain sort of fragile situations not tipping over the point into conflict or into large-scale crisis because of a public health crisis, right? So there could be a selfish interest there to intervene, and if you can do that by allowing some of your health professionals to go there temporarily, that might be rather cheap to do. And that's a very economic argument I would make here. I wouldn't underestimate the forces of competition also in this context. Say if you are in a strong position like the Philippines is in a very strong position. If you think about Tunisia also sort of sends a lot of nurses, I believe, but also doctors to European countries. If Tunisia was to say, okay, we allow, or we think about exit restrictions, because there are some countries here that offer us an agreement under which people can return temporarily to help out. If you don't offer that to us, you know, we don't need you. It's fine for our people just to go there. You know, that will be enough in terms of remittances and everything. We don't need you, right? The competition for doctors and nurses globally is such that you can use these forces, I would say. And you don't have to, in a sense, be on good terms with everyone. And you can pick and choose just in that sense as an origin country. And you can pick and choose those who offer you this sort of crisis mechanism, for example.
Thank you. And thank you to both of you for these really interesting presentations. That will conclude our time we have today. Thank you everyone who joined us here in person and who joined us online. As a reminder, our next seminar for the Migration Policy Center is going to be on Tuesday, April 18th at 10:30. And the topic is on governing migration through funding and the implications of the 2018 refugee reception reform in small and medium towns and rural areas in Italy. If you want to stay up to date and on our event announcements, the best way to do that is to join our mailing list or follow us on Twitter. Thank you everyone for joining, and thank you again to our speakers.
Thank you.